In parts of the world where this specific mineral is high in the drinking water, suicide rates are lower, violent crime is lower, and dementia is less. Yet if you try and buy it in Canada or Australia, it's treated like a dangerous substance. But in places like the US, it's a $10 supplement you can buy anywhere. Today we're talking about the most misunderstood trace mineral for your health, and it's lithium. Not the psychiatric drug, and you need to see the data on why this might be the missing link for your mood, sleep, and even how your body uses vitamin B12. I'm Michael Smith, naturopathic doctor, and today we're diving into the benefits of lithium orotate. Most people hear the word lithium and they immediately think of the drug lithium or lithium batteries. But today we're talking about lithium orotate, which is completely different. And here's the critical distinction. Pharmaceutical lithium is lithium carbonate, and it's prescribed at dosages of 600 to 1800 milligrams a day. And blood levels have to be monitored regularly. The therapeutic window is narrow, and too much and you're in trouble. And it can have lots of side effects. Lithium orotate is a completely different category. A standard supplement delivers around 5 milligrams of elemental lithium. And that's not just a smaller version of the drug, it's like a completely different conversation altogether. Think of it as like iron. It's like comparing getting an iron infusion, which is high dose iron, to eating an iron-rich meal. The dose makes the difference. And that's the distinction not made by regulators in places like Canada, Australia, and other countries. And it's why it's classified as a drug regardless of the dose. We'll talk about that a little bit later. The orotate part matters too. Orotic acid acts like a carrier and improves how lithium crosses into cells, including your brain cells. And that's why the orotate form is preferred at the lower dosages. Here's one of the most compelling pieces of evidence for lithium as a trace mineral that we need. Researchers have compared regions with higher versus lower lithium concentrations in the drinking water, and across multiple studies spanning different countries and populations, the pattern is consistent. Where lithium is higher, the rates of things like depression, suicide, violent behavior are lower. A 2021 systematic review and meta-analysis looked at the data across 2,678 regions, and they found that this association held up. So we're talking about low-dose trace levels of lithium, not the drug here. And it's the same logic as iodine and thyroid function. Where iodine is low in the soil, thyroid problems go up. We don't call iodine a drug, we call it a nutrient. And that's why we have things like iodized salt. And lithium may belong in the same category, and the research is starting to back that up. Let's look at the benefits of lithium. Benefit 1, mood stabilization and emotional resilience. Lithium modulates dopamine and serotonin signaling. At these low dosages, it's not a blunt force intervention like medications or drugs. It's more like stabilizing so you stop getting the ups and downs. The people who benefit most here are not the people in crisis. They may need medication. They're the people who describe themselves as being fine but flat, or just very reactive emotionally, have low-grade irritability that doesn't have an obvious cause. And this is where I've also seen it work well clinically, especially for PMDD, which is premenstrual dysphoric disorder. And that's different to PMS, which is often a hormonal imbalance. The mood and irritability that comes with this luteal phase change is more of a neurochemical component, and lithium helps to stabilize this and stabilize the mood changes that happen around that time of the month. Benefit number 2 is sleep quality. Lithium isn't a sedative. It doesn't work the way melatonin or phosphatidylserine or sleep drugs work. What it does help regulate is a circadian rhythm at a cellular level. It influences the expression of clock genes that govern your sleep-wake cycle. And when that regulation is off, sleep is light, fragmented, or just doesn't feel quite restorative. So if you've addressed things like cortisol, sleeping patterns, and can't get good results of sleep, lithium is worth considering and trying out. Benefit number 3 is the B12 connection. And this surprises many people, but lithium plays a role in transporting B12 and potentially folate into the cells. Think of it this way, B12 needs a key to get through the cell membrane and actually do its job, and lithium is part of that key. Without enough lithium, B12 can look perfectly normal in a blood test result because it's circulating around in the blood, but it's not getting to where it needs to go inside the cell. And this is clinically relevant for anyone supplementing with B12, but they've still got methylmalonic acid out of range, or they've got symptoms of fatigue, brain fog, and their B12 deficiency symptoms are not changing. Benefit number 4 is anxiety and stress. Lithium helps regulate glutamate, the brain's primary excitatory neurotransmitter. And when glutamate signaling becomes excessive, the result is anxiety, rumination, and that feeling of being stuck in your head. It also modulates the HPA axis, the stress response, and that can help to reduce your excess cortisol levels over time. Anxiety is probably the main reason why most people have tried lithium. Leave a comment below if you've tried it and if it's helped you or not. Now, those are the immediate benefits for mood, but one of the most exciting parts of research lately is what this mineral can do to your brain, not just now, but 20 years from now. Let's look at the long game. Benefit number 5 is neuroprotection. And this is where the research is genuinely exciting, and there's more and more research into this area. Lithium inhibits an enzyme called GSK3 beta, which is implicated in the formation of the plaques and tangles associated with Alzheimer's disease. It also helps to increase BDNF, brain-derived neurotrophic factor, which supports growth and survival of neurons. A 2023 review described low-dose lithium as reducing neuroinflammation, reducing amyloid beta accumulation, and promoting neuroprotective BDNF expression. And a long-term study published in 2024 found that patients who had received lithium had significantly higher cognitive scores compared to placebo, 25.5 versus 18.3 on a standard cognitive test, years into follow-up. So if you have a family history of dementia, you're already noticing early changes cognitively, this is one of the most evidence-based nutrients you could try at low dose, and it's very safe. In places like Canada and Australia, all lithium, regardless of the dose, is classified as a drug. The frustration here is there's no meaningful safety concerns at 5 milligrams that justifies this classification as a 900 milligram psychiatric medication. It's a bit like classifying chamomile tea as a sedative drug because it contains compounds that promote relaxation. It's the dose that makes all the difference, and that distinction simply isn't being made. In the US, lithium orotate is available over the counter as a dietary supplement, but not everybody should be taking lithium orotate. Anyone already on prescription lithium, do not combine these drugs without medical supervision. The monitoring requirements for pharmaceutical lithium exist for a reason. Adding more lithium on top could change that view. Anyone with chronic kidney disease, lithium is cleared through the kidneys and it's perfectly safe with normal kidney function. But if you have chronic kidney disease and impaired clearance of lithium, it may start to accumulate. Also, people taking NSAID medications regularly, ACE inhibitors for blood pressure, or diuretics. These medications are also cleared through the kidneys, and that may slow down lithium clearance as well. If you're on any of these medications, I'd be careful of adding lithium without working with a prescribing doctor. If you already have a pre-existing thyroid condition, high-dose lithium is well known to affect thyroid. Lithium orotate has a much lower risk, but if you're on thyroid medication, I'll just monitor the thyroid levels if you start adding it in. And to anyone who tries it and feels worse. Some people can feel more flat or fatigued or notice mood changes in the wrong direction. That's a signal to stop or reduce down the dose and see if it works better for you. This is not a supplement that people need all the time. Most lithium orotate supplements deliver 5 milligrams of elemental lithium per capsule. Some people do well having 5 milligrams daily. Others find that once or twice a week is enough, especially if you're using it for mood stability rather than acute support. I personally use around 5 to 10 milligrams a week. Not taking it every day, but just enough to help with that neuroprotection effects. So start low, try 1 capsule and see how you respond before adjusting. And your doctor probably won't have much familiarity with lithium orotate. This falls out of conventional prescribing. And this is one time where working with a practitioner who understands nutritional medicine can make a real difference here. Lithium orotate is one of those supplements that's generally underappreciated, not because the evidence is not there, but because the name carries the baggage from the lithium drug. At nutritional dosages, it's a trace mineral with real benefits for sleep, mood, brain health, and long-term neuroprotection. If you have any questions about lithium, leave a comment below. I'd be interested to know other people's experience with taking lithium orotate.